Welcome, Dr. Sponaugle. I'm so happy that you've joined us, and I've got the opportunity to ask you questions because it's an opportunity for everyone to hear you. And the first thing I want you to do is just give us a little bit about your background. I know you're an MD, but you have a specialty, and just a little bit about the specialty, your background, and how you developed the specialty that you're in today.
Okay. Well, originally, after medical school, I did some internal medicine training. Decided I wanted to do intensive care only. I always enjoyed the sickest patient in the ICU. So I moved to the University of Florida and trained in anesthesiology and intensive care, and did some fellowship training as well in pain. In private practice, practiced OR anesthesiology, some intensive care, and more pain toward the end of toward the early 90s. And working with pain patients, I always heard horrific stories about how they had gone away to a detox center and twitch, jerk, diarrhea, anxiety, spasm, all kinds of muscle spasm, etc., when they went through detox. So I wondered why the detox was so terrible. And stepped back, analyzed the physiology of detox, and realized that the majority of the negative symptoms, the terrible heart racing, blood pressure elevation, things that are really dangerous, and the tremors and shaking, which we now know from PET scan studies actually cause brain cell death. If you have a detox where you're shaking and twitching like this, it's a symbol of excess electrical current in your body and your brain. And when you have that excess current, you're actually frying brain cells. They've proven this now with PET scan research. So I analyzed what makes the patient do this when they're coming off of OxyContin or alcohol or Xanax. And it's mostly a surge of noradrenaline out of the A5 nucleus, a factory in the brain. And I wondered why nobody had really addressed that, because in the operating room in the CCU, we would use intravenous medications, alpha blockers, beta blockers, that would prevent the adrenaline when a surgeon operates from reaching the receptor on the heart so the heart wouldn't race to 110, 120. We were getting elderly people with bad hearts and arteries that were blocked through hip surgery, knee surgery all the time. If the physiology of withdrawal is this surge of adrenaline, somewhat analogous to what a patient would have under anesthesia, if we weren't addressing it, why don't we address it the same way we would a patient with heart disease? So I used my intensive care skills to first design a technique for detox that was relatively painless, but the focus was on the safety for the heart and the brain. And began detoxing patients. And it took a couple of years, from 98 to 2000, to get this detox to the point where patients have no withdrawal symptoms at all, pretty much nothing.
Amazing.
First for pain pills, then for alcohol. And interestingly, alcohol becomes an opiate, and most physicians don't know that, but alcohol breaks down through alcohol dehydrogenase to acetaldehyde, one of the bad chemicals we'll talk about later, because the yeast overgrowth in the gut produces a lot of acetaldehyde. But acetaldehyde combines with brain dopamine and forms an opiate molecule. So when people drink 2 glasses of wine or 2 beers, they actually load their Percocet receptors with an opiate. Isn't that amazing?
Yeah.
But the withdrawal from alcohol or Xanax, Valium drugs, or opiates precipitates this massive surge of adrenaline, which was really never checked. And I was wondering why, and I thought about the prejudice I saw in medical school toward addicted people. We were taught early on to kind of laugh at the guy who's twitching or jerking. He's just an old alky. So a lot of prejudice. And you're taught that in medical school and residency. The public has it because the physicians have the prejudice. So because of prejudice and somewhat of a lack of interest, I think, and the fact that psychiatrists had pretty much controlled detox for 50 years, and they're not physiologists like anesthesiologists or intensivists. They really hadn't worked to create a better detox. So I designed a detox that did not allow the adrenaline to surge, did not cause tachycardia or elevated heart rate, elevated blood pressure, no twitching, no diarrhea, all the bad stuff. And that was great, but the patient still relapsed. I thought initially my job was to design this humane and safe detox and then send them to AA or to 28-day programs. they all relapsed and came back, and I said, why'd you come back? Well, I was in a black hole. My brain just doesn't feel right. And I learned then, from 2000 to around 2005, we learned all kinds of biochemical issues that caused patients to feel more normal on Percocet or alcohol or cocaine. One patient takes cocaine, feels more focused, more energy, and normal. Another patient takes cocaine and feels paranoid. What's the difference?
Right.
So first I had to dig deeper into the neuroscience. What does the drug do in the brain? What chemical does it release or block? And then look at what's causing the anxiety. And for the first 5 to 7 years, I would stop craving in so many individuals who had gone to 10, 15, 20, 30-day programs where they couldn't be talked out of their craving. But I did it with medications. And I assumed that everything I saw, dopamine deficiency, serotonin deficiency, different anxiety disorders, I assumed it was all inherited. And I would talk to the parents, and I would assume mom had a worry syndrome, so she passed a gene that the patient makes less serotonin. Well, it turns out that once you understand the physiology of the gut and the connection between the gut and the brain, 80% of the people I see today who are addicted to drugs that relax the brain, reduce the electrical current in the brain because they have excess current, those issues are from the gut itself. So we've made a progression from designing a detox that didn't hurt and didn't damage the heart or brain. The old-fashioned detox reduces the blood flow to the brain and the heart by about 30%.
So what happened, just to summarize, so what happened is you designed the detox, then the people went home, they went to AA or whatever, and then they relapsed because
we didn't
they
change
didn't
the
feel
brain.
good.
If you don't change the brain, you don't stop the addiction.
Right, so they're in a black hole, they're in depression, and so they relapse, and you went and said, wait a minute, there's some missing link here.
What's the missing link? What is it that makes this sister, successful 40-year-old realtor, feel abnormal on Percocet, but her 37-year-old sister that has been through 10 rehab programs, never has money for a car payment or apartment. This sister pays for everything.
Yeah.
She looks at her sister after paying for all this for 10, 15 years, says, what is your problem? We both had the same terrible or good childhood.
Right.
That's not the factor. So much focus on the psychological, environmental. And we see many patients who have soul pain, and they will medicate soul pain. But every one of those patients has brain pain. And
Right.
brain pain is when the biochemicals in the brain are out of balance. Some is inherited. 80 to 90% of what I see today is probably from the gut.
So in this period of time, when you started seeing the connection to the brain first, so it was the addiction, then the connection to the brain, that happened for a period of time, right?
Yes.
And then you got the gut piece. You started seeing
Yes.
that went to the gut. How did that happen? And I know you've got a case
I
story.
have to embarrass myself because I started going to a lot of neuroscience meetings, the PhD scientist meetings versus the MD meetings in 2000, and learning more about the brain. But 5 years ago, it was around 2005, I go to a neuroscience meeting, and so I'm looking at 1 o'clock lectures. There's 4 different lectures. You're trying to decide which is the best. One of the titles was, "It's the Gut, Stupid." And I tell my patients, today, I was too stupid to go to that lecture. I didn't get it. It is the gut, stupid. And I was too stupid to go. I would stop the craving using Lexapro, Paxil, Prozac, different medications. The addiction is caused by different deficiencies or excess of brain chemicals. I was using Western medicine to balance that chemistry and stop the craving. So that was a cause below the symptom. The symptom is addiction, alcoholism. The cause below that was an imbalance in brain chemicals or neurotransmitters. I was treating that with symptom treatment, American medicine, classic symptom treatment.
Right.
And now we're below that to a cause. That cause of addiction was a symptom of a deeper cause. So you peel back the layers of the onion,
Right.
and you find that the intestinal tract, when it's dysfunctional, when it has all kinds of imbalance of bacteria and yeast, creates tremendous neurotransmitter or brain chemistry imbalances that cause depression, anxiety, insomnia, chronic fatigue, fibromyalgia. Fibromyalgia, anxiety, insomnia are all three the same thing. All three of those are excess electrical current in the brain and the body. The patient that has that, because doctors fail to diagnose the cause, they will use any drug that turns down the voltage. The opiates are classic. We use opiates, Percocet, Vicodin, OxyContin, to turn down the electrical voltage. They prevent calcium from going into the nerve. So does magnesium. The bad gut has magnesium deficiency, so they have excess electrical current. But we use them to turn down the voltage in a sciatic nerve that's pinched, right?
Right.
Well, patients who have overactive brains use those drugs not for body pain, but for the brain pain, for the anxiety, insomnia. They use alcohol because it activates the GABA receptor, just like Ambien, Xanax, and Klonopin. They are prescribed those drugs by the symptom doctor. The guy who treats the symptom doesn't know the underlying cause because he's stuck in Western medicine. What I learned in medical school is big pharma-based medicine. And we were taught to ignore the gut and ignore all the natural medicine. If we arrogant MDs had listened to naturopathic doctors like yourself 20, 30 years ago, you folks warned us of an Armageddon that was coming, a point when the antibiotic levels were so high in food and city water that there would be an Armageddon. And we've arrived now at a point where anxiety, panic anxiety, and panic disorder anxiety, insomnia have all three tripled since 1980.
Wow.
And it's because of the gut.
And I want you to go through a little bit of that gut piece today because you actually have an example of a case
Sure.
study, and it's extremely interesting. It really is.
We're going to correlate neurotransmitters, body or brain chemicals that turn up or turn down the electricity.
Okay.
This case is an astonishing case, even for me. Let me explain that patients who have anxiety, let's go back to the antibiotics for a moment before we get to this young lady.
Okay.
The first mass production of penicillin was in 1944. Dr. Fleming told scientists in Britain that we should take the mold toxin from penicillin mold. It's a strong toxin. It will kill bacteria. We can make an antibiotic out of it.
Right.
Like all pioneers, he was mocked. He died before anything was done. In World War II, when British and American troops were dying, or having trench rot and all kinds of different infections, another scientist found his old mold bottle on the shelf in the British laboratory and pulled it down, and they created penicillin. The first mass production was 1944, American and British troops. Post-World War, we bring this miracle drug penicillin back to America. The turkey and chicken farmers who had already moved from having 8 chickens running around the barnyard like your grandfather or your great-grandfather, they weren't cooped up 300 chickens or turkeys in a chicken house. That all changed. Those guys said, wow, if one of my turkeys or one of my chickens gets pneumonia, I lose 250 chickens.
Right.
This miracle drug from Britain, this penicillin, let's put it in the turkey food, in the chicken feed, the turkey feed.
Right.
We've been doing this since 1945. It has caught up with us. We decided we want a more tender steak. We want to pay a lot more money for a steak you can cut with a fork versus a knife. How do you get that? You don't allow the cows to roam free range and pick up omega-3 like they should from the grass. We pin them in a pen, standing in their own feces. They stand in their own poop. Let's just be honest. You did a show called The Poop Scoop.
Yeah.
They stand in their own poop. Don't let them run. They're all packed into this corral out in Kansas City. Don't let them move. There's plenty of fat. We feed them a lot of grain. Well, they feed them antibiotics to keep them from having infections.
Right.
But it's not natural for them to stand all together in all this feces and bacteria. So even the beef that we want, that fattest steak, has the antibiotics laid in it, unless you have organic. So over all these years, 65 years, we have been placing antibiotics into the food. Then we've been prescribing more and more from the pediatricians, et cetera. Now, when a patient has an infection, you don't want to let them have a streptococcal infection and not treat it with an antibiotic. Otherwise, they get rheumatic fever, they get heart valve damage. But what we didn't know, what the naturopathic doctors have tried to tell us for 25 years or so, is you have to also give that patient an anti-yeast, antifungal regimen. So we're at the point now where 74 cities have studied the antibiotic levels in their water. The federal government doesn't require that. Doesn't require that any city water supply measure medications because they're assumed to be safe for people because it's a medication. 74 cities at last count have. And it's interesting, Philadelphia, for instance, had 3 different antibiotics that were not therapeutic levels, but it's a national healthcare system coming, free antibiotics in the water. They had Zifirmax, amoxicillin, and Bactrim, all 3 in city water. What has happened is each generation is hit with a higher antibiotic level than the previous generation at an earlier age. For instance, when I was 10 years old in 1966, how much antibiotic was in the city water?
Right. And
But
now,
for my children and their children, these kids are hit with a much higher level at a younger age. So what's happened is we now see, since 1980 to 2010, the tripling of depression, panic disorder, all these things. What we also see, I began running operating rooms in the early 80s. We did not see, Brenda, never saw 18-year-old, 15-year-old kids, 25-year-old kids coming in to get scoped for reflux and heartburn.
in fact, we are seeing that today,
It's
absolutely.
50% of the folks getting a scope now for reflux and heartburn are 25-year-olds.
Right.
We only saw the patients who were 50 or so because they had a hiatal hernia which caused reflux.
Right.
So what's the difference? The correlation of all the increase in these young people getting scopes because of heartburn and reflux correlates with the increased levels of antibiotics, as all these Americans have been imbibing antibiotics over the years, and we move it out into the stool, it goes into the water. The water's recycled.
Yep. And we've
They
got
do
it
not
there.
filter the antibiotics out of the water,
Right.
nor the Motrin and all the non-steroidals that also cause gut problems and leaky gut.
Right.
I assumed, I'm sitting here as a physician assuming, well, they kind of recycle this, they clean everything out of it. All they do is add more poison. We put more chloride, bromide, chemicals. The requirement is lower the bacterial count to a certain level. So we've been imbibing these antibiotics, recycling, moving them out for generations. So now our children are losing the good bacteria, God's bacteria, the lactobacillus that makes the lactic acid, the bifidus. These good bacteria keep the bad guys at bay.
Right.
We have a little bit of good yeast. Well, when the pH in the gut changes because the pH goes up because we have no more lactic acid production, and this is the world you've been living in for years, the bad guys take over. The Candida excess causes so much of a change in the gut and in the brain chemicals.
And that's what
And
has
that's
happened here,
yes,
right?
Exactly.
Show us this example, because this is
This
fantastic.
is just an amazing example. This is a SPECT scan. I've been using SPECT scans in my addicted patients for 7 years. I don't use them in all the patients, and I'm at the point where I don't need the scan to.
Because you pretty much know.
Well, I can talk to a patient for 5 minutes and tell you what their scan looks like, with the exception of trauma. But this is a young lady who lives in Virginia, and she lives 20 minutes from Amen Clinic. So she goes off to college. She's very sharp. She wins an academic scholarship to UVA, tough school. And you can see on her scan an overactive posterior cingulate, which is typically correlated with a high IQ. She also played volleyball so well, she has a volleyball scholarship. And we see on the scan an overactive cerebellum, eye-hand coordination.
Which is the white area,
white area
in the scan.
On these scans, what you expect to see is a red cerebellum. Blue is normal activity. Everything that's red is overactive.
Is overactive. So anything in that
Yes.
picture they're seeing as red is overactive.
Overactive.
Okay.
This young lady goes to school, comes back at Thanksgiving, and her parents find OxyContin in her suitcase, and they are scared. So they go to Amen Clinic because it's a 20-minute drive. They get her scanned, and the physician at the Amen Clinic said, you need to go see Dr. Sponaugle. He'll figure out why your daughter's using OxyContin.
Okay.
So they come in with the scan. I have mom and dad, which I love. I love having moms particularly, because I want to know, what was this young lady like at 10? Did she have separation anxiety at 5? Did she bite her fingernails at age 5? That comes from serotonin deficiency. If she did, she may have inherited it. She more likely had a lot of antibiotics for ears and throat. Early on, age 1, 2, then she becomes worried. Because what happens when the yeast and the gangs, we call them, the bad bacteria and the bad yeast take over the gut,
Right.
because antibiotics have destroyed the good bacteria,
Right.
We shut down the first step in making serotonin. The first step in making serotonin occurs mostly in the small intestine. Tryptophan in the turkey is converted to 5-hydroxytryptophan, which then goes to the brain, and inside the brain cell becomes serotonin. Now, serotonin turns down the electrical voltage.
Right.
When patients develop serotonin deficiency, they develop overactivity in 2 specific regions. This circle
In the center.
in the center is the emotional center or the deep limbic system.
Okay.
It becomes overactive with serotonin deficiency.
Okay.
This patient was a happy-go-lucky, no problems, no depression, no anxiety. In August, goes to school, comes back at Thanksgiving. She's moody, irritable, negative, easily offended, has lost the desire to socialize, and she's depressed. She isn't enjoying things she used to enjoy. Those symptoms all occur with serotonin deficiency from an overactive emotional center. Serotonin deficiency, overactive deep limbic or emotional center, this is the personality you become that you were not prior to having your gut destroyed. Now, she also develops this anterior cingulate overactivity.
Which is in the front of the brain.
Yes,
on the scan.
and this is normally a gear shifter, but when it becomes overactive, you can't shift gears. You become focused on the negative. You become stubborn, my way or the highway. Sounds like an older person. You know, grumpy old men, they have serotonin dropout as they get older.
Right.
Well, this young lady, in 16 weeks, goes from a happy-go-lucky profile, brain profile, to all this. What she was using the OxyContin for was to decrease the electrical voltage here to feel normal again. But how did she get this in 16 weeks? 2 things happened.
Oh, shit. So her gut became out of balance
Her gut,
in 16
her gut
weeks.
caused all of this.
Yeah.
This young lady goes to school. She's brilliant. The first semesters all repeat. She joins a sorority. Now, she's out 4 nights a week drinking beer for the first time in her life because she doesn't have to study.
Yeah.
Okay. Now, everybody who saw her, previous doctors and everybody, we conjure up ideas. If we don't know the science, we conjure up all these other things. Well, college is too stressful. She can't handle college. That's why she's using OxyContin. Wrong. It was not stressful at all. She had too much playtime and no parents. Before she's an athlete, she's focused, she's driven. Now she's drinking beer. Now she has genetic ADHD. Those patients don't have 1 or 2 beers. She didn't sip 1 or 2 beers like the other girls who are out there 4 nights a week in the fraternity houses, wherever they're at. The cake
She drank
parties.
a lot of beer.
She drinks 8 beers every night. Now, I had to work to get this out of her, but when you know, again, when you know the science, you say, okay, something happened. Either her estrogen dropped out, because when estradiol in a woman drops below 80, the serotonin receptor is closed. God made you guys much more complicated than me. we just kick the tire and ask how much horsepower it has, right? But you ladies lose your estradiol, you get the same
so
thing.
she starts drinking a lot of beer
Drinks a lot of beer.
and gets the
4
Candida
nights a week
overgrowth.
at least, she's drinking 8 beers, 32 beers. Now, beer is made with yeast. Beer has yeast in it. The favorite food of yeast is alcohol because it's a 2-carbon chain.
Right. So
it's easy to break down and the yeast proliferate. So she develops a yeast overgrown gut. The mycotoxins from the yeast shut down the serotonin production in her small intestine. She develops serotonin deficiency, which causes these overactive worry center, overactive emotional center.
So her personality
is totally different. Oh, she was a terrible person to her mom and dad. This is not my daughter. This is someone different. She became the same person a woman becomes for 5 days premenstrual if her estrogen drops too low.
Gotcha.
Okay? So that was why she was using the OxyContin.
Gotcha.
So how do we fix her? Well, first of all, let's prove a few things we said. We talk about how yeast and bad bacterial toxins are neurotoxins. They're fatty. They go right through the gut, to the blood, and right to the brain. There's a filter that protects the brain from the blood called the blood-brain filter. Well, guess what's not behind that? The pituitary gland.
Gotcha.
It is hit by every toxin in the blood very quickly. The toxins from the yeast shut down the pituitary. So now she's not activating her thyroid as well. She's not activating her adrenal glands as well. 90% of pure adrenaline, epinephrine, is made in the adrenal glands.
Right. So she's got.
Now a normal adrenaline level is around 10.
So you can
Notice
see this
she's
on
down
the
to
chart.
6.
Yep. You can see that.
Here's a young 19-year-old girl who now has adrenal insufficiency, not primary adrenal insufficiency, but secondary from the pituitary not activating the switch because of the yeast and bacterial toxins. So her adrenaline level is low, so now she's depressed and lethargic. Noradrenaline, 90% is made up in the brain, not in the adrenals. Her noradrenaline has dropped to half normal,
Right.
16, and we'd like to see her at 35 to 40. That is because the toxins have shut down this central factory. So now she's not feeling like the champion athlete. She feels like she has a 50-pound cement block on each leg.
And that's the chronic
Yes,
fatigue.
and that's the fatigue.
Yeah.
Now it gets worse.
So she's now got cement legs,
Yes.
yeah.
Now, her dopamine is elevated, but slightly. But because her gut is full of yeast, she
Yeah.
doesn't absorb copper.
Yeah.
Dopamine naturally converts to noradrenaline, but the cofactor for dopamine hydroxylase is copper.
Gotcha.
These patients develop every mineral deficiency there is because they don't absorb minerals well. So we have excess dopamine, and these first cousins, adrenaline, noradrenaline, dopamine, are totally out of balance. Serotonin deficiency, to prove the point, normal is 180, she's now 90.
Gotcha.
And that's why she has those overactive brain
Right.
regions.
So that's a perfect example we're putting up on the screen.
Absolutely.
And the gut, brain, the addiction.
This is what I see every day. Patients using alcohol or opiates like Vicodin, Percocet, OxyContin,
Right.
or prescribed from symptom treating doctors, Xanax, Ambien, etc., for the anxiety insomnia that's actually caused by the deficiency of serotonin, taurine wasting from yeast overgrowth, and excess histamine. When the gut begins to leak the proteins and histamine surges, histamine activates the electricity in the brain like dopamine.
And I think, Dr. Sponaugle, your work is fascinating, and it affects so many people in this world and you've got such a piece of it that no one else has. I mean, the addiction, the anxiety, and the gut connection to the brain you're a
fascinating.
pioneer, and I want to
Thank you.
tell you, I am honored to have you here today, and I thank you so much
Well, thank you.
for your work.